Hi there, welcome to In the Clinic Before and Afters. I'm Dr. David Jack and I'm a cosmetic doctor working in London. In this episode we're going to meet Sinead, who works as a nurse and has been having quite a stressful time at the moment. So I'm going to do a couple of different non-surgical treatments which should hopefully make her feel a bit better.
Hi, my name is Sinead. I'm 38 years old and I'm a nurse. I do basically spend my time looking after everyone. My mother, I have to fly over to Ireland to look after her a lot. Unfortunately, she's not too well. I feel I've kind of neglected myself and I need a little pick-me-up now, and I'm hoping that this today will give me the confidence I need.
So Sinead, you've started to notice some changes in your face. Yeah. Can you just explain what is bothering you?
I feel I need treatment around my brow line or this area here. It's very noticeable.
Sure.
I'm getting wrinkles on my forehead.
Sure.
Definitely my tear trousers.
I think that there's a number of different ways that could probably help you just look a little bit less tired. I mean, definitely what you suggested with the frown lines and some of the lines in the forehead. Sure. Botox is a very nice and simple solution to that, provided it's not overdone. And what we're trying to achieve by doing that, so doing a little bit of Botox in here and here, tiny bit in the forehead, is just to lift everything. So relaxing the muscles that are pulling down to open the eyes up a wee bit. And the forehead, just reducing those lines ever so slightly with a tiny dose of Botox. What we need to be aware of is the heaviness in the brows and not to do too much up here. So doing a very light dose will really be key for that. And around about the eyes, I think doing a little bit of filler directly under the eye there would be the thing to do, combined with a little bit of filler just to replace some of the volume that's been lost there. And the reason that you have volume loss is the same as everybody. With age and with stress and dehydration, generally speaking, Botox is very low risk, tiny risk of bruising with that, tiny risk of headache on the day of the treatment. Fillers, there's slightly more risk, but still very low risk. So things like bruising, swelling, lumpiness can happen with fillers, but very low risk. Usually swelling would be normal for the first day or so, and then after that, usually things just settle down completely. Any questions at all, Sinead?
No.
No? Okay.
Questions.
Okay, perfect. Let's get started. Specific things that I'm going to try to tackle with her is to do a bit of Botox to kind of lift things up, open the eyes up a bit, make her look a little less kind of furrowed and stressed, and use a little bit of filler just to replace some of the volume that's starting to be lost from her mid-face area, which will just help lift everything up, make her look a little less tired, and hopefully give her just a sort of feeling of rejuvenation more than anything else. So I'm going to start off with the Botox. Okay.
It's going to be a bit different than me being the patient now. But yeah, I don't mind needles, it's fine. It's going to be all worth it anyway. I just want to feel like me again. Obviously, being a nurse, it's kind of in me to make sure that I would be getting the best doctor for any procedure, and I know how to do research.
There we go. This is all done. Bed tonight, I would say sleep slightly head up if you can.
Yeah,
try to sleep on your back rather than your side.
Okay.
And if you're a wee tiny bit swollen tomorrow, just some Piriton.
Yeah, I have that already.
Okay, cool.
Thank
Great,
you.
that's us. No worries.
Yeah, I was fine, pain-free pretty much. Yeah, good.
I look like Cindy Crawford now.
Nice to see you again. How are you doing?
Hi James, I'm good thanks. I'm here for my appointment.
Right, you can go through it.
Thank you.
Hello Sinead. So tell me, how are things after the treatment?
Yeah, really good. I'm really happy with it.
Sure.
I got what I wanted, as in something subtle, but I think it's made a big difference.
Great, okay.
I'm really happy with the results. I mean, as I said, I didn't want anything too severe. I just wanted subtle little changes, but they've made a big difference for me.
Perfect. Yeah, cool. Then, do you mind popping your glasses off? I'll just have a wee look. So just frown really hard for me, raise your brow, and screw your eyes up a wee bit. Okay, perfect. I think one thing I might just do is do a tiny wee top up of the Botox on this side, just get a wee tiny bit of a peak there.
Sure.
Other than that, I think that we're kind of good.
I'm
so
happy with it.
Okay,
yeah.
Perfect.
It's been a really good experience for me going to Dr. Jack.
It says all done.
I just felt and looked, in my opinion, just really kind of tired and fatigued. I feel that the results, it's definitely brightened me. I think you can notice the difference, but again, it's a subtle difference. Things just seem to be going a bit better for me job-wise. I have a really good job opportunity coming up to go travelling worldwide, and I'll have a nicer face to do it. I feel really happy.
Having been very apprehensive about treatments initially, Sinead seems to have had a really great result. Often with Botox for the first time, you might need a little bit of adjustment. Sinead had a little tiny bit of peaking just on the lateral brow, which can happen with Botox if there's maybe one little fibre that's still quite active. So did a little bit of top up for Botox. She was happy with the results, so decided not to do any more treatments whatsoever, and she'll probably come back in about 6 months and top things up. But great, nice, subtle result, very age appropriate, and she was happy with this, so it's really a win-win. So if you enjoyed watching this today, then please subscribe to my channel, set the alerts bell for new videos, and leave any comments or queries that you want me to answer, and I'll try to get back to you as soon as I can.